I had a new client come in today. She was a 68-year-old female with a history of left breast cancer with surgery and radiation. And she had the radiation all along the left side, up into the neck as well too. And what's happened over the years is that that left shoulder is chronically tight and it's starting to pull forward. And as it continues to pull forward over the years, she's starting to get more neck and shoulder pain, as well as limitation of her shoulders, and her posture is starting to suffer. So she came to me and said, "Ed, help, anything you can do for me." Everyone, welcome to the channel. Ed DeBoo, physical therapist from Integrative Physical Therapy in beautiful Bellingham, Washington. So the first thing I asked her what she was doing, and she says, I'm doing these chest openers or I'm stretching my shoulder back all the time. She's like, I've been doing that exercise for years, but I'm not really making any progress. When I come into a door frame and I do my stretch, my left side is so much tighter and I don't really know what to do. From a clinical standpoint, that tightness of the pectoralis muscle is what's causing some of that forward shoulder. I'm exaggerating, but it's going to bring that shoulder forward. And as it does that, your neck is going to want to go down, but you don't want to look down, so then you look up. So then you end up with cervical, thoracic kind of tightness. You get weakness of the rotator cuff. So the first thing we have to do is bring that shoulder back and down. And so we've got to lengthen up the pectoralis. But she's been stretching and it hasn't been helping. So then what you need to do is think about trigger points in the pectoralis muscle that could be contributing to the tightness. So what you're going to need is a lacrosse ball. And you'll notice here is that the trigger points are right along this whole inside edge of the pectoralis muscle. And so I'll show you how we're just basically going to go up against a wall. We're going to do a stretch. We're going to first come into a door frame and we're going to do a stretch. And we're going to identify where we are the most restricted or where that feels like it's the tightest. And then we'll grab the lacrosse ball and we'll do a little 30 seconds worth of trigger point work with that. And then we'll retest to see if we're getting some flexibility. All right, let's go do it. First thing we'll do is we're going to come to a door frame, and I really like the door frame stretch to open up the chest a little bit. You're going to start with your elbow about the same height, bring one foot forward, and you're going to lean into it. And so when she leans into it, her right side is much more flexible. Her left side, where she had the cancer treatment and the radiation, is quite a bit tighter in this position. So the good thing is she knows she has the capacity to stretch a lot further, but because of the radiation treatment and the scar tissue, her left one is pretty stuck. And I asked her, okay, where are you feeling most of the tightness at? And she's like, God, it's just right there. Then what you'll do is you're gonna get your lacrosse ball and we're gonna come up against the wall and do a little 30 seconds of trigger point work right on that area. Lacrosse ball works the best. A tennis ball does work, but I really think you should get a lacrosse ball. You're gonna find that spot, you're gonna come into a door frame, and you're gonna lean into it. Remember, trigger point work should be slightly face cringing. And what I'm basically doing is I'm just kind of rubbing out that tendon a little bit, and I want to go all around where that sore spot is. And I'm going to work this for about 30 seconds. After 30 seconds, I come back to the wall and I lean into it, and chances are I will have gained just a little bit of flexibility and I'll be able to open up that chest a little bit more, especially on the left side. If you want to do one arm at a time, that's fine. But the idea is that you want to go back and forth. Now we'll recheck it. Come into it and say, okay, you know what, it's not quite so tight there. Now it's just really tight right about there. Get your lacrosse ball from your back pocket. You come up here, you come against the wall, you work it for 30 seconds, put it in your back pocket, and you come back here and you recheck. And usually I'll have people do that sequence back and forth 3 times. After the third one, that's when you're going to come into here using your breath, and you're just going to hold and maintain this stretch for about a 30-second count. Another technique then I'll have them do is a contract, relax. So what you'll do here is I'm going to gently push my elbows into the wall, basically contracting the pectoralis muscle. Then I'm going to let it relax and I'm going to lean into it. Oftentimes 3 contract relaxes will buy you just a little bit more flexibility as well too, and then you're going to hold that stretch for about a 30 or 40 second count. I'm a huge believer in trigger point work, not just for scar tissue from radiation, but just from living your life, and just we tend to get trigger points and muscles all over our body. And so this particular example, I was just talking about the pectoralis, but you can use this concept anywhere. I have all sorts of videos on the channel about trigger point work. If you have a question about a specific muscle that you have trigger points in, I'll leave a comment down below and I'll see if I have a video on it and I'll send you the link. All right, everyone, thank you for watching. If you found the video helpful, please consider giving it a thumbs up, and subscribing to the channel is the best way to support me. And we'll see you at the next video.